Hi there, Dr. Rajiv Iyer here with more secrets on how you can be successful as an international medical graduate doctor in the USA. Here, I'm going to give you a list of 10 outstanding programs that take IMGs like you for an observership program. I have verified the list myself. I am going to give you a link on where to apply and also in the end give you a step-by-step instructions on how to apply. Let's do this together. Number 1 on the list, in no particular order, is University of Pennsylvania Children's Hospital of Philadelphia. University of Pennsylvania is an Ivy League university. When I say about Ivy League, these are reputed universities in the US. And in fact, most US graduates want to do their training in Ivy League universities. Children's Hospital of Philadelphia is affiliated with University of Pennsylvania and provides all the pediatric services there. Children's Hospital of Philadelphia is the oldest children's hospital in the world, established in 1855, and is also one of the largest in the world. Have you seen this video of a lamb in an artificial womb? People all around the world are watching this. It's a viral video on YouTube. This innovation is from Children's Hospital of Philadelphia. Number 2 is Boston Children's Hospital, which is located in Boston, Massachusetts. This is affiliated with Harvard Medical School. Everyone in the world recognizes Harvard Medical School, right? For the observership, you do not need to take any exams. Most of the IMGs have this question, do I need USMLE for this? The answer is no, because your role is functioning as an observer. You might have read during your medical school or during USMLE that hydroxyurea is a medication used for sickle cell disease. I read that this drug was first used in sickle cell disease at Boston Children's Hospital. The next on the list is Cincinnati Children's Hospital, located in Cincinnati in the state of Ohio. This is affiliated with the University of Cincinnati. Cincinnati Children's is an outstanding hospital. This was also built in the 1800s. Now, when you're thinking of this observership, remember that many of these reputed programs charge a fees for this. They could have an initial application fee and they may also have some fees for you spending your time as an observership. So, when you apply for observership, you may want to plan for the expenses you have. By the way, fun fact, you must be familiar with the oral polio vaccine, right? Called Sabin vaccine. This was discovered by Albert Sabin at Cincinnati Children's Hospital. Hi. Number 4 is Texas Children's Hospital, located in Houston, Texas. This is affiliated with Baylor College of Medicine within the Texas Medical Center. Texas Children's has some limitations on what the purpose of observership should be. Now, some hospitals may have this, but other hospitals may not. So be upfront about what you're trying to get out of this observership, what your ultimate goal is. For the observership programs, you need a visa to travel to the US, obviously, right? So this visa typically is B1, B2, although people come on a few other visas. But the most common ones I have seen is B1 and B2. The observership programs do not sponsor any visa, so you want to have your own visa. You also need some funds to stay in the US and also to take care of your food and travel. So plan accordingly all your expenses when you're coming in for an observership program, because these are not supported by the hospital. Next on the list is Children's Hospital of Colorado, which is located in Aurora, Colorado. This is a more than 100-year-old hospital. This is affiliated with University of Colorado Denver School of Medicine. In fact, Colorado is a great place for any adventurous activity. So if you're into any of this, you can explore Colorado. You can have a great vacation there, plus do your observership. How cool is that? The next on the list is Nationwide Children's Hospital. This is a children's hospital located in Columbus in the state of Ohio. This is again a more than 100-year-old hospital which provides you various opportunities to rotate through many specialties. When you're going through observership, you have to remember this is not clerkship, meaning you won't have any physical contact with patients. You cannot do any clinical care. You cannot do any procedures. You cannot place any orders. Clerkship is something that the final year medical students do. This is different. But what you can do is you can stand at the bedside when the rounds are on and listen to the discussion that is going on. You can attend grand rounds for the department. You can be a part of journal club, case discussions, and other non-patient related activities. One opportunity is you can go have a lunch with one of the consultants who can provide you a lot of insight about your specialization and how things work in the US. You never know, you might even get a letter of recommendation. Here are some of the benefits I see with the observership you can do. You can put this on your CV, which will make your residency matching competitive. You can establish connections with US consultants. You learn how the system works. So when you're doing your interview for matching, you can talk about it. Well, I say all this because I've seen this happen. The next on the list is Lucille Packard Children's Hospital in Stanford, Palo Alto, California. They provide opportunities for a lot of different observership. Do check it out. I have left the links to all these observership programs in the description below. If you click on these links, this will take you directly to each individual hospital's website through which you can apply for an observership program. The list so far I gave you is all children's hospital, but it doesn't matter. This will make you competitive for both pediatric and adult residency programs. Now I'm going to tell you 2 adult hospitals. This is the same. This will still make you competitive for either pediatric or adult residencies. And the next on the list is Einstein Hospital. This is a part of Jefferson Hospital Network in the city of Philadelphia in Pennsylvania. If you click the link in the description below, you'll see the various options they provide and the duration of the observership they have provided for each specialty. The next on the list is Cleveland Clinic, located in Cleveland, Ohio. This is more than a 100-year-old hospital. They have a reputed adult cardiac program. So if you're interested in adult cardiology, you should keep that in mind. Finally, I will tell you how to apply for the observership. When you click the link, you will see what all documents are required. The things you will require are typically your picture. So make sure you have a nice profile picture of yourself. You have a personal statement, which is a 1-page document describing all about yourself. This is not a CV or a resume. This is a summary of all your accomplishments in 1 page, also saying why you're interested in doing an observership and what you want to get out of this ultimately. So have that document ready and have your CV updated, look nice, crisp and clean without any typos, any errors. I'm going to make a different video on how your CV should look. So that way, when someone sees your CV, they're pretty impressed with that. Be prepared to submit 2 to 3 letter of recommendations. Some programs may ask to submit right away and some programs may ask later on and some programs may not even ask for it. However, be prepared that you may need your letter of recommendation. The other things you need is a scanned picture of your passport, all your medical degree, diploma, your internship certificate, your specialization certificate if you're already a specialist. So keep all these things ready because you may have to upload 1 or more of these when you're submitting for an application for observership. One additional thing that is really important is your vaccinations should be updated. So make sure you have a documentation of all your vaccinations. If not right now when you're applying, the programs will certainly ask you at a later time even before you start your observership. Especially after COVID, you have to make sure you're vaccinated against COVID. Otherwise, your paperwork will be delayed and you won't be able to start your observership. Because ultimately, you want to start your observership and time it accordingly. So this will help with your NRMP matching. I hope all this makes sense to you, right? You have any questions about any documents? Post in the comments below. The really good thing about the list I provided you is all these being reputed organizations have a central system through which you can submit all your documents and then they would be directed from there to individual departments. For example, you apply here and you want to do, let's say, observership in anesthesiology, your application will be specifically sent to the anesthesia department. Similarly, radiology, it would be sent to the radiology department. So it's so well organized and coordinated. This will make your life easier because you just have one place to apply and then select what department you want to rotate in. Now that you learned about observership and how to improve your CV and hopefully make some connections, next I recommend you watch this video on what are the IMG friendly specialties that will be easier for you to match as an IMG. I have also other videos that are related to you as an IMG that I have in the description below. Do check them out one by one so you get a complete idea of how you can be successful as an IMG doctor in the USA. Any questions? Post in the comments below. I will get back to you as soon as possible. Take care, stay safe. I will talk to you soon. Hi there. Hi there, let's turn it off. Residency, this will make your CV more competitive.
What?
Competitive?
Competitive.
Competitive. Huh?
Yes.
You can put this on your CV, which will make your residency matching competitive.
Yeah.
It's hospital.
Hi.
Hi.
Yeah.
This is what happens when you're recording. What your ultimate goal is? What's going on, guys? This is a great program you should keep in mind to go to.